It's 7:43. This is News Extra, and brought to you today by Gehring Civic Center. Here's Kevin Mooney.
Thank you, Dennis, and good morning, everyone. Dr. Todd Sorensen is here, CEO for Regional West Medical Center, and we're very pleased to have him here. I talked to him, a few weeks ago, and I asked him if he wouldn't mind stopping by, and we'd talk about a few things going on at the hospital, and pleased to have him here. And I guess one of the first things we need to talk about is this new fiber optic line that is kind of changing the way you guys do records. I did a kind of a previous story about this, about the way it's hooking up with the various hospitals here in the Panhandle, but it also hooks up to hospitals in Colorado and everywhere else, right?
Yes, it does. And this was an award we got from the Federal Communications Commission about, almost 5 years ago now. And it took us a long time to get it all organized, but the construction on the project was all finished at the end of 2011. All of the electronics have been installed, and we're in the process of getting this system tested. This is about 750 miles of fiber, connects all the hospitals in the Panhandle plus the hospital in Grant together, and then we have a big fiber connection to Denver on the internet. So this really will change things, make it easier to do telemedicine, to transmit x-rays and all of that kind of thing. So it's pretty exciting, actually. We're going to have a ribbon cutting ceremony on July 18th. So this is a pretty neat thing.
It's a pretty big deal. Because,
yes, it's a big deal.
A lot of times you guys, people didn't realize it, but doctors had to wait a long time to get records coming in at a certain time. It would take, a half an hour, as much as an hour to get records from one hospital to another? Well,
especially x-rays, x-ray images. We did a test, transmitted 151 x-ray studies from Chadron down to Scotts Bluff. Before this system, that would have taken over half an hour. It took about 2 minutes with the new system. So what that really means is that if someone goes into the emergency room in Chadron or in Gordon or anywhere else in the Panhandle, and they have an x-ray study, they get an interpretation back within 10 or 15 minutes, so they don't have to sit and wonder what's going on.
Yeah. So this will be this is a major help. So.
Yes, this is a big deal.
Yeah, no question about it.
One thing I want to add is that when we put this fiber in for healthcare, we also put in fibers for commercial development, and so there's some economic development impact of this as well.
Yeah, I remember that, and so there's some fiber there that you guys can sell for commercial development?
What we did was we made an arrangement with a company called Zayo Communications out of Colorado, and they're the ones that are developing all of that commercial fiber. Now they can develop it themselves. They can sell it to others like Action or Allo, and I think they have sold some to them for whatever purposes they want to use it. So internet access all over the region should get a lot better.
Yeah. Okay, one other thing, another thing we wanted to talk about is you got some money to help in managing pain for patients. Is that right?
Yes, we did, and this is what we're doing is creating a patient-centered medical home for chronic pain management. Chronic pain management is a really challenging situation. These patients are very complex. They suffer from chronic pain and really have a hard time. So we put together a proposal and submitted it to Blue Cross Blue Shield of Nebraska, and they liked what we want to do here. They think it'll be more efficient and more effective in treating these patients, and so they awarded us a grant over 3 years worth nearly $800,000 to help get this set up and to test it. What we have to do is track our results so we can show whether it works or not. But we think this is pretty exciting, and it's really trying to develop much more patient-centered care models. So that's we're about halfway through the first year on that, and so far the results look really promising. We have patients who have better managed pain, so they don't go to the emergency room as often, they don't end up in the hospital as often, because we can do a better job taking care of their pain problems.
Okay. We'll be back with Dr. Sorensen right after this.
Beyond belief, beyond compare. You want a venue with added value, with professional staff to assist in event planning, and the Meat Shop's 29 years of catering experience, you can effectively amaze 1,150 of your closest friends. Book your small dinners, picnics, banquets, and meetings of all sizes. Call West Nebraska's premier multifunction facility or visit us at www.gearingciviccenter.com. The Gearing Civic Center. You've been here, you know.
All right, we are back on News Extra, and we have Dr. Todd Sorensen here, CEO from Regional West Medical Center, and we've been discussing a number of things, and one of the other items we want to talk about is the expansion that you guys were planning, which is the whole reason why we did the Avenue B construction and remodeling of that area and so forth, and you may not be doing some of that as early as you thought you might.
That's right, Kevin. We had planned to expand our surgical suite right away, but there's some really interesting things going on in healthcare nationally right now, and that is that all over the country for the last 2 years, we've seen a decrease in number of patients in hospitals, number of patients going to doctors. People aren't really sure what's behind all of that, but we think it's much wiser to let the dust settle, if you will, and figure out what the real demand will be before we expand facilities. Moving the street was still a really good thing because we no longer have our employees crossing Avenue B and dealing with traffic problems. So it's much safer and much more convenient for our hospital employees, but the expansion we had planned, we will probably postpone for the time being. We're continuing to monitor that and make sure we don't invest in something that we can't really justify.
Okay. And then, of course, you guys have also been, one of the things you wanted to do was bring some additional people in, some specialists, and recruit some physicians in. I think you wanted to do 20 in 5 years or something like that. Wasn't it 25 in 5 years?
Yes, we wanted to increase our medical staff by 25 in 5 years, and we're pretty much on track to do that, actually maybe a little ahead of that. We have resolved some shortages we had in anesthesia. We've recruited several anesthesiologists. Brent Ellison is one of them. He grew up in Gearing. And we've also recruited physical medicine and rehabilitation specialists to help with our pain program. One of these, Dr. Greg Wilroy, is from San Antonio, Texas, and has done a lot of work with the Wounded Warriors program. So we're pretty excited about that. We've also recruited some emergency room physicians, which we needed badly. We've recruited an ENT and facial plastic doctor, a man by the name of Julian Henley, who is a really interesting guy. He's an inventor. He holds about 32 patents, and he'll have time to do his inventing, and he'll also do some outreach for us. We still have some big challenges ahead of us. It's very difficult to recruit general internists, and it's difficult to recruit family practitioners, so we're working on that. Of course, we have a family practice residency program, and that helps with family practice, but there are still some big challenges for us.
Yeah. Were you looking at one time, I think you were talking about having somebody that could do heart surgery or something like that? Here, possibly, we're trying to figure out whether you actually had enough demand for that here, as to whether you might do that here, or maybe it'll still be done down in Fort Collins. I don't know.
Yes, we've monitored that pretty continually. What we really think would be good here is to have an interventional cardiology program. That's basically where you use catheters instead of surgery to deal with arteries. We really don't think we have enough patients, enough people in the region to justify having a heart surgery program here. We don't think we would do enough to be very good at it. And we are working with the cardiologists from Heart Center of the Rockies in Colorado on our cardiology program. So that's a
kind of a work in progress.
Yeah, I guess you'd call it a work in progress. Yes.
All right. Very good. Well, thanks for stopping by. Appreciate it.
Sure.
Good conversation.
Enjoy it. Thanks, Kevin.
All right, you bet.